Today our topic about early miscarriage, symptoms, causes, and treatment. We know that miscarriage can be a hard and sad experience, no matter when it occurs. In this video we are talking about early miscarriage. What is early miscarriage? Early miscarriage refers to loss of a pregnancy in the first trimester. The majority of early miscarriages occur before the pregnancy is 10 weeks gestation. Some miscarriages happen very early, even before a woman is sure she is pregnant. Miscarriage is a relatively common experience, but that doesn't make it any easier. Take a step toward emotional healing by understanding what can cause a miscarriage, what increases the risk and what medical care might be needed. Miscarriage is more common than many people realize. About 10 to 20% of women who learn they are pregnant will have an early miscarriage. The rates of early miscarriage are even higher when women are checking home pregnancy tests very close to the time of their period and are finding a positive test very early. By chance alone, 1% to 4% of women will have 2 miscarriages in a row. However, it is very rare to have 3 or more miscarriages in a row, which is recurrent miscarriage. In medical terms, early miscarriage is called an early pregnancy failure. This means that the pregnancy failed to develop. Almost all early miscarriages are due to circumstances beyond anyone's control, and were destined to happen before the woman even knows she is pregnant. Now let's talk about miscarriage symptoms. Most miscarriages occur before the 12th week of pregnancy. Bleeding, light bleeding early in pregnancy is fairly common, and does not mean you will have a miscarriage. Brown discharge. This may look like coffee grounds. This discharge is actually old blood that has been in the uterus for a while and is just coming out slowly. Spotting, bright red bleeding or clots. Passage of tissue through the vagina. A gush of clear or pink vaginal fluid. Abdominal pain or cramping. Pregnancy symptoms, such as breast tenderness and nausea, begin to go away. Dizziness, lightheadedness, or feeling faint. If you have any symptoms of a miscarriage, you should contact a doctor right away to have an evaluation. It will be important to have an ultrasound exam to look into the uterus to see if the pregnancy is normal or you are having a miscarriage. Even if you think you passed the entire pregnancy and are feeling better, you should see a doctor. Sometimes, passing tissue occurs with an ectopic pregnancy outside of the uterus, which can be life-threatening if not diagnosed early. What causes early miscarriage? Almost nothing you can do will cause an early miscarriage. Avoiding sex or heavy work will not impact an early pregnancy. There are a lot of changes that need to occur with the cells and genes in a developing pregnancy, and sometimes those changes do not happen perfectly. There are some health conditions or habits that can increase the chance that an early miscarriage will occur, including heavy smoking, use of illicit drugs, especially cocaine, poorly controlled diabetes, hyperthyroidism or hypothyroidism, physical problems with the uterus, including fibroids or abnormalities of development of the uterus. Treatment of early miscarriage. Not all miscarriages need treatment. The choice of whether to wait for the pregnancy to completely pass without any treatment is up to you. Our doctors are committed to providing options for all patients, including the pros and cons of all available options when miscarriage is diagnosed. All patients with Rh-negative blood, regardless of which option they choose, need treatment with Rh immune globulin, an injection that prevents a woman from forming substances in her blood that may attack the baby during a future pregnancy.